Ever wondered if dates could be harmful to your health? While these sweet fruits are often hailed for their numerous health benefits, from providing a natural energy boost to aiding digestion, there's another side to the story. Today we're shifting the focus to explore how dates might not be the best choice for everyone. Indeed, certain health conditions can be exacerbated by the consumption of dates. Are you ready to venture beyond the usual health narrative? Now, let's delve into the specific health issues that can be worsened by dates. First on our list is diabetes. Now, this might seem counterintuitive because dates are often promoted as a healthy alternative to processed sugars. But when it comes to diabetes, it's a little more complicated than that. Let's delve into the science behind this. Dates, like many fruits, are high in natural sugars. This includes fructose, which is a simple sugar that can quickly be converted into glucose in your body. This rapid conversion can cause a spike in blood sugar levels, which is a concern for individuals with diabetes. Now, this doesn't mean that if you have diabetes you can't enjoy dates, but it does mean that you need to be mindful of portion control. A small serving of dates can fit into a balanced diet, but consuming large quantities could potentially push your blood sugar levels into the danger zone. It's also worth noting that not all dates are created equal. For instance, medjool dates, which are larger and sweeter than many other varieties, also contain more sugar. This means they could have a greater effect on blood sugar levels compared to smaller, less sweet varieties. But there's also a silver lining here. Dates are rich in fiber, which can help slow down the absorption of sugar and prevent blood sugar spikes. This is why it's essential to eat them in their whole, unprocessed form whenever possible. But, and this is a big but, it's crucial to remember that everyone's body responds differently to different types of food. What works for one person might not work for another. This is particularly true for individuals with diabetes who often need to carefully monitor their diet and blood sugar levels. In conclusion, if you're living with diabetes, it's not necessarily a hard no on dates. But it does mean that you need to be aware of the sugar content and mindful of portion sizes. And of course, always consult your healthcare provider before making any significant changes to your diet. So, if you're diabetic, remember to consult your healthcare provider before incorporating dates into your diet. Next, we have digestive disorders. Diving into this, it's important to note that dates are a rich source of dietary fiber. This attribute of dates is usually celebrated, as dietary fiber is known for promoting a healthy digestive system. It aids in the movement of food through the digestive tract, preventing constipation, and even reducing the risk of developing certain conditions, like heart disease. However, the very benefit that makes dates a darling to many can also be a pitfall for some. Yes, you heard it right. In some individuals, especially those with certain digestive disorders, consuming dates could lead to uncomfortable symptoms. Let's take irritable bowel syndrome, also known as IBS, for instance. People with this condition often have sensitive bowels that react to various food items, and unfortunately, dates can be one of them. The high fiber content in dates can cause symptoms like bloating, gas, and even abdominal pain in people with IBS. These symptoms occur as the body attempts to break down the fiber. During this process, gas is produced, which can lead to bloating and discomfort. For those with IBS, their gut may respond to this with spasms, leading to pain and further discomfort. Moreover, dates contain a type of sugar called fructose. While fructose is a natural sugar, some people may have a hard time absorbing it. This condition is known as fructose malabsorption and can result in symptoms similar to IBS when dates or other high fructose foods are consumed. So, while dates are a healthy food choice for many people, they may not be suitable for everyone. If you have a digestive disorder like IBS or fructose malabsorption, consuming dates might cause more harm than good. It's always wise to listen to your body and observe how it reacts to different foods. If you notice any discomfort after eating dates, it might be best to limit your intake or avoid them altogether. Therefore, if you suffer from a digestive disorder, be cautious with your intake of dates. Moving on, let's talk about dental problems. Dates, those sweet, chewy little fruits that we all love to snack on, have a dark side when it comes to dental health. Their sticky nature and high sugar content can be a recipe for disaster if not handled properly. Imagine this, you're eating a date, enjoying its natural sweetness, and suddenly a piece gets stuck between your teeth. Now this might not seem like a big deal at first, but let's consider the implications. Dates are packed with sugars, and these sugars are prime food for the bacteria residing in our mouths. When these bacteria get a hold of the sugars, they produce acids as a byproduct. These acids can slowly but surely eat away at the enamel, the protective outer layer of our teeth. This is called tooth decay, and it's not something you want to invite to your mouth party. This process is exacerbated by the fact that dates are, well, sticky. The sugars don't just pass through your mouth, they cling to your teeth, providing a continuous supply of food for bacteria. So not only do you have the initial sugar rush, but you also have a longer-lasting impact due to their stickiness. Now, this doesn't mean you should stop eating dates altogether. They have numerous health benefits, including being a great source of fiber and antioxidants, but moderation is key, especially for those already dealing with dental issues. In addition, proper oral hygiene cannot be stressed enough. Brushing and flossing after meals, especially after consuming something as sticky and sweet as dates, can go a long way in preventing tooth decay. Using a good mouthwash can further help in neutralizing the acids produced by bacteria. It's also a good idea to pay regular visits to your dentist for checkups. They can spot the early signs of tooth decay and provide treatments before it becomes a major issue. In summary, while dates have many health benefits, their high sugar content and sticky nature can cause dental problems if not consumed wisely. So, if you have dental issues, it's worth considering your consumption of dates. Now let's address the issue of weight gain. Dates are a delicious and nutritious fruit, packed with natural sugars, fiber, and a variety of essential nutrients. But like with all things, moderation is key. Why do we say this? Well, dates are also high in calories. A single medjool date, for instance, contains about 66 calories. Now, that may not seem a lot at first, but consider this. If you eat just 5 of these dates as a snack, you've already consumed over 300 calories. That's equivalent to a small meal. Now, consuming calories isn't inherently bad. In fact, our bodies need calories for energy. The problem arises when we consume more calories than our bodies can burn. This excess intake can lead to weight gain, especially if it's a regular occurrence. Let's put this into perspective. Imagine you're an individual who is already overweight or obese. You're trying to lose weight, so you're on a diet that limits your daily calorie intake. However, you love dates and end up eating a handful as a mid-afternoon snack. Those extra calories, if not compensated for by physical activity or a reduction in other food intake, can slow down or even reverse your weight loss progress. Moreover, while dates are a good source of dietary fiber which can help you feel full and satisfied, their high sugar content can cause a spike in your blood sugar levels. This can lead to an energy crash and increased hunger later on, causing you to eat more. So it's easy to see how eating too many dates can contribute to weight gain. It's not that you should completely avoid dates if you're trying to maintain or lose weight. They have many health benefits that shouldn't be overlooked, but it's important to keep your consumption in check. Consider them as a treat, not a staple. And always remember, balance is the key to a healthy diet. So if you're trying to maintain or lose weight, be mindful of your date consumption. Lastly, we tackle allergies. Now, this is an area of concern that can often be overlooked when considering the potential side effects of consuming dates. Allergies can be tricky, and they can sometimes manifest in unexpected ways. Some individuals, for instance, might find that they're allergic to dates. It's not the most common food allergy out there, but it's certainly not unheard of. The symptoms of a date allergy can vary greatly from person to person and can range from mild to severe. At the milder end of the spectrum, someone with a date allergy might experience itching and swelling. This could be localized to the mouth and throat, or it might extend to other parts of the body. It can be uncomfortable, but it's not typically life-threatening. However, in more severe cases, an allergic reaction to dates could lead to difficulty breathing. This can happen when the body's immune system overreacts to the presence of date proteins, triggering a response that causes the airways to narrow. This is a serious condition that requires immediate medical attention. The severity of an allergic reaction can depend on a variety of factors, such as the amount of dates consumed, the person's overall health, and their individual sensitivity to date proteins. It's also worth noting that cooking or processing dates can sometimes reduce their allergenicity, although this isn't guaranteed to work for everyone. It's important to remember that allergies can develop at any age, so even if you've been eating dates without issue for years, it's possible to develop an allergy later in life. So, how can you tell if you're allergic to dates? The only surefire way is to get tested by a healthcare professional. They can perform a variety of tests to determine if you have an allergy and can provide advice on how to manage it. If you suspect you're allergic to dates, it's best to avoid them and consult a healthcare professional. You don't want to take any chances when it comes to your health, and a professional can provide the guidance and treatment you need. To wrap up, while dates offer numerous health benefits, they can also exacerbate certain health conditions. Over the course of this video, we've delved into the complex relationship between dates and various health issues. We've explored how, despite being packed with nutrients, dates can cause problems for individuals with specific health conditions. Firstly, we touched on diabetes. Although dates are a healthier alternative to processed sweets, their high sugar content can cause blood sugar levels to spike. This can be particularly problematic for people with diabetes who need to carefully manage their sugar intake. Next, we examined digestive disorders. Dates are high in fiber, which is usually beneficial for digestion. However, for those with certain digestive disorders like irritable bowel syndrome, this high fiber content can trigger symptoms such as bloating, abdominal pain, and altered bowel movements. Then we journeyed into the world of dental health. Dates, while delicious, are sticky and sweet, and can cling to teeth, providing a breeding ground for bacteria that lead to dental issues like cavities. Regular and thorough oral hygiene practices are crucial, especially if you're a fan of these sweet treats. We also discussed weight gain. Dates are calorie-dense, which means eating them in large quantities can contribute to an excessive calorie intake, leading to weight gain. Portion control is key when including dates in your diet. Finally, we talked about allergies. Though rare, some people may have an allergic reaction to dates. Symptoms can range from mild itching and redness to severe anaphylaxis. If you suspect you have a date allergy, it's crucial to seek medical advice. In essence, while dates are a nutritious addition to most diets, they may not be suitable for everyone. The importance of moderation cannot be overstated. Just because something is healthy doesn't mean it should be consumed in unlimited quantities. It's always wise to consult with healthcare professionals, especially if you have an existing health condition. They can provide personalized advice based on your specific needs and circumstances. Remember, the key to a healthy diet is balance and moderation. Stay informed and make the right choices for your health.